speaking, if you can put your, if you can go on mute, and that will just help us make sure to eliminate any background noise. So I want to welcome everyone. My name is Brandon Leonard. I'm the chair of the Men's Health Caucus of the APHA. And I want to thank you all for joining our meeting today. We decided to use a bit of a different format today and to invite a panel of guest speakers to talk to us about what's happening in Men's Health Month, Men's Health Week, and broader men's health activities. So we're very excited to have three excellent speakers with us today. And after our panel discussion, we will have a brief business meeting to go over just a few items for the caucus updates. So I'll just ask if y'all can stay on mute if you're not speaking. And then if you have any questions as we go through, feel free to put those into the chat box. And then we'll just save any questions until all the speakers have made their remarks. And then we'll take the questions then. Okay. Great. So let's get started. So I'm pleased to introduce our speakers. And first, I'll introduce Dr. Doris Bardell, who is a physician with a specialty in public health and social medicine. She's worked in public health administration and has served as a university lecturer at the University in Bielefeld and as a guest lecturer in other universities. She led the development of a set of indicators on gender-specific health for all 16 federal states in Germany between 2001 and 2003. And this set of indicators has been functioning for almost 20 years and is the basis of many health reports in Germany at the national, regional, and municipal level. Dr. Bardehle has been working for the Men's Health Foundation since 2009 and currently serves as a coordinator of the scientific board. She has contributed to the 4 men's health reports published by the foundation so far. She brings over 40 years of experience in medical statistics and public health to these efforts to understand problems of poor health of men compared to women. She is also a member of the Board of Trustees of Global Action on Men's Health. Dr. Bardehle? Thank you.
Thank you, Brandon. You introduced me so nicely. We can start with slides, and I have prepared some, and I will explain you what we have done during the last months and years. You can see from the words of Brandon that I have done many things in my professional life, be it in the administrative field, in the former GDR, and later in federal Germany, especially in Bielefeld in North Rhine-Westphalia. Today, it's mainly about my work for men's health in Germany, which I started 10 or 11 years ago in the Men's Health Foundation. For 17 years, the Men's Health Foundation has been involved in high-profile methods to draw attention on men's health disadvantage. Thus, for Germany, we have established December 10 as a day of shortened life expectancy of men, while women live until December 31. That's how much the difference in life expectancy makes, calculated on one calendar year. This is very illustrative and is supported by national and regional and local campaigns. I would now like to present information on 3 important men's health activities in Germany. That is the finished Men's Health Week, the first one. No, the first slide, please. First one. What? And then the status of development of action plans and the health strategy. And the third is the cooperation with the global action of men's health. And I'm very glad that Peter Baker is today here with us. Now the second slide, please. the second one, yeah. We have celebrated Men's Health Week for a number of years. This has not been a political level action in Germany so far, but has developed from the bottom up, mainly through the Foundation of Men's Health and through regional men's health networks, and in recent years through bloggers and other internet activities.
No, you're fine.
You can understand me?
Yeah.
Okay. Already in January this year, the foundation has developed an action plan because requirements for focal points for the Men's Health Week were requested from the communal basis from the federal states. And in February this year, we posted the text on the foundation's website. The main focus was already in 2020 to direct all efforts towards the mitigation of the COVID-19 pandemic. The situation has since improved, but vaccination rates are still not enough, and new mutations and problems with further lockdown in both boys and men will keep us busy for some time in future. The next slide, please. In accordance with the Board of Global Action of Men's Health, strengthening of well-being and mental health was another focus, because mental health has deteriorated due to the pandemic. There's a further increase in depressiveness, in aggressive behavior, in domestic violence, increased addictive behavior, and other mental disorders. And we have mental problems with children too. We use the action plan to develop further international cooperation, such as with Global Action of Men's Health, with WHO Europe, and with WHO Healthy City Network, which is working very well in Germany. And to use the Men's Health Week for fundraising is an important issue because of self-financing of the foundation. The next slide, please. And another activity was a social media campaign. Similar to the example of Ireland, to give each day in the Men's Health Week a special character, we use the calendar of existing international and national action days to develop a plan for social media campaign that has close reference to men and also to mental health. The social media campaign was concluded with a family day as in Ireland and other countries. Männergesundheitsnetzwerk Kommunal in Baden-Württemberg, one of our federal states, collects now the activities of this year's Men's Health Week through a survey and will report them in an online event this Friday. We are interested to see how many activities will be recorded. The next slide, please. Action plans now and men's health strategy. What is now our way to go in this direction? For action plans and the men's health strategy, active institutions at the federal, state, and local levels, as well as well-acting networks, are needed. In addition to a professional association and magazines for men, there are 3 organizations in Germany that want to promote a men's health strategy and action plans. And this you can see here, that is Boys and Men's Health Network, then the Federal Forum of Men, and the Foundation of Men's Health. We started to work out document within a kick-off workshop in April with 20 participants. That means these 3 institutions had 9 experts in the first working group, and the results of these working groups have been discussed with a further 20 participants. And now we have the following actions. Here you see the first action. That is a letter to the Bundestagsfraktion Bündnis Grüne, die Grünen, of the Green Party, who are not, this party is not prepared to support measures for reducing the gap in life expectancy between men and women. The parliamentary group of these Greens of the Bundestag is of the opinion that men themselves are to blame for dying 5 years earlier than women. This view was probably also prevalent during the pandemic, so that the higher morbidity and mortality of men was hardly discussed. The response to the letter we have written, these 3 groups which you see here, to this Green Party is still pending. That means we did not get an answer, but the letter was sent last week. And the next is this here, the topic 3. Writing a powerful and urgent manifesto for men's health strategy and action plans for the federal election in September this year. There are 5 requirements for a men's health strategy articulated, and 7 initial steps are suggested in this document. But the document is not yet ready. We are still discussing who the addressees should be, the Christian Democratic Party or the Green Party. That means the parties with the best chance of winning the election. The next slide, please. Now the topic of international cooperation, specifically the cooperation with global action of men's health. We have been working with global action of men's health for a number of years, especially intensively since becoming a member of the Global Action Men's Health Board of Trustees. The core countries like United Kingdom, Ireland, United States, Canada, Australia have so much experience in the field of men's health that we can benefit from it and also get a lot of advice. From the margins to the mainstream, a report on experiences and summary of the countries that have created and practiced men's health strategy so far is very helpful for us in Germany. We have learned that there is a top-down way as in the United States and the bottom-up way as in Germany. Top-down is not as difficult as bottom-up, but both ways need special concepts. We have translated this concept and distributed it to our experts in Germany, but also to the German-speaking countries like Austria, Switzerland, Luxembourg, and Liechtenstein. On the initiative of Global Action of Men's Health, we have chosen a uniform logo for the Men's Health Week this year, which I have used on the slides. You can see this on the left side. It is also helpful to have an overview of all the programs available for the Men's Health Week this year on the website of the United States Men's Health Network. Many thanks to Jimmy. We are on the website. The first time you see is here on the bottom. And now the last slide, please. We would like to thank all the countries that are pioneering men's health strategies and supporting us to do even more for men's health. And I would also like to thank Brendan for giving me the opportunity to present the achievements in Germany here and today. Thank you very much.
Wonderful. Thank you so much, Doris. That was an excellent presentation and very informative to learn more about the great work that you're doing in Germany. That's fantastic. So I want to remind everyone, if you have questions, please put them in the chat box and we'll take the questions after each of our speakers have had a chance to make their remarks. So now I'm pleased to invite our next speaker, Dr. Noel Richardson. Dr. Richardson has extensive experience in the area of men's health at a research, policy, and advocacy level. He is a principal author of the first ever national policy on men's health in Ireland, which was published in 2009, and a follow-up National Men's Action Plan published in 2016. He has worked as a policy advisor on men's health at the Health Service Executive since 2005. He is also co-author of the first European Union report on men's health published in 2011 and is currently collaborating with the World Health Organization on the writing of a men's health strategy for the WHO European region. He completed a doctoral thesis on men's health and masculinities in 2007. His research interests include men's health policy, gender and health, mental health, and suicide prevention in men, and health promotion targeted at hard-to-reach population groups of men. He has presented at national and international conferences on men's health and is a board member of the Men's Health Forum in Ireland and a member of Global Action on Men's Health. Welcome, Dr. Richardson.
Thank you very much, Brendan. Thanks for that introduction. I'm delighted to share with you some of the updates on men's health in Ireland that relate to policy, Men's Health Week, and some of the programs. So I'll just enlarge this here before I start. Can everybody see that okay? Great. Well, Brandon, you gave me quite an extensive list to cover in 10 minutes. So I hope I can keep the time, and if not, I'm sure somebody will give me a reminder. So I'll just kick off and talk a little bit about policy. I can't believe it, but we're 12 years into implementation of our national men's health policy at this stage. Time flies when you're having fun. The first policy on the left, the national men's health policy, was quite a broad, visionary, all-encompassing document. And one of the key recommendations from Peter Baker's review after 5 or 6 years was that a more streamlined action plan that would align to our national strategy might get better traction in terms of support within Ireland. And that's exactly what we did. So Healthy Ireland Men, the document on the right, is essentially applying a gender lens to some of the key priority programs in our national strategy, Healthy Ireland. And as I'll share with you shortly, that has generated some good successes in terms of development of national men's health programs, and more importantly, in terms of getting funding through health services and other public health funding streams, which we struggled to do in the earlier drafts of the policy. So I'm glad to say that men's health policy is still alive and well. We've always had very good relations with women's health, and we adopt the perspective of kind of gender and health very much in our approach. In terms of Men's Health Week, I just want to acknowledge the huge role by Colin Fowler, who's Director of Operations at the Men's Health Forum in Ireland. And as ever, Colin this year did sterling work in promoting the week. So our theme this year was making the connections coming out of COVID-19 and the pandemic. And the call to action was check in, check up, and check it out. So check in with yourself in terms of, is there anything you can do to address your own health? Check up on others, colleagues, neighbours, family members to see if they need help or assistance. And check it out. Check out if you're concerned about any aspect of health, be it your own or somebody else's help. Try not to hesitate in terms of taking some action and getting some help or support. I won't go into all the details, but Colin put an excellent toolbox up on the Men's Health Forum in Ireland website. The link is there in the bottom. And that gives an indication of of the broad range of local and regional initiatives that were held throughout Ireland during the week. It also contains some of the branded materials. There were postcards, posters, challenges and choices, men's health manual. We also had two fairly high-profile national events. We had the launch of a research document, which I'll come back to in a second. That took place on the Monday and was launched by our health minister. And the Wednesday, we had a really good turnout at an Engaging Men webinar series. So Colin, as I said, has done huge work. And I was glad to see this year that it was rewarded with particularly good coverage, both on mainstream media and social media. Hashtag Men's Health Week was trending in the top 5 on Twitter for most of the week. More details, as I said, is on the Men's Health Forum in Ireland website. This is our Engage Men's Health Training Programme. This has been a key pillar of men's health policy and implementation in terms of a capacity building measure. So at this stage, Engage has been rolled out to thousands of service providers, not just in the health services, but with NGOs, community voluntary sector, and others as well. And the program has evolved and developed. There's a module on, say, engaging young men. There's a more recent module on engaging middle-aged men in relation to mental health. And the most recent addition, I'm glad to say, is a partnership with the Department of Agriculture. And just last week, we rolled out a Train the Trainer program to train agricultural advisors to support and signpost farmers in relation to health. And this is a really exciting and innovative development, I think. So it's supporting agricultural advisors to have a more proactive role in supporting farmers in relation to health issues. And we have a PhD student working on that study. Another really exciting project is the Sheds for Life program. This is a health promotion program targeted at men's shed members. There are over 400 sheds in Ireland now. And that the report I mentioned a few minutes ago was Sheds for Life Impact Report, which was launched by our Health Minister on Monday of Men's Health Week last week. And there's also a study protocol paper that was published in BMC Public Health. So if you want more details in the program, either of those resources would be a good place to go. But just to say a little bit about the program in brief, it builds on the inherent health promoting qualities of sheds as a place where men feel a sense of safety and trust, where there's camaraderie, a sense of purpose by doing things. And it's a very informal environment. So a formative evaluation of this program made it very clear that shedders didn't want sheds to be turned into another version of health services. So the program is very sensitive to that point. It's not trying to impose a health agenda on sheds, but it's very much co-produced and co-developed with men in sheds. And this is an overview of the program. So there are kind of 4 key pillars with a health check, physical activity, healthy eating, and mental health workshop. So these were the 4 areas that shedders were most vocal in terms of wanting to have as core pillars of the program. And the ones on top then are all the elective aspects of the program. So shedders can opt in or opt out of those as they choose. So the program, while there are concrete pillars or modules to it, it's very much a dynamic program that we expect will evolve and adapt over time. For example, already older men in sheds are looking for modules on sexual health and on more detail on older men and mental health, so including, say, dementia and Alzheimer's, which seems to be a key concern amongst the older cohort. So that this program faced challenges during lockdown, during COVID, but the next rollout of the next phase is due to commence in September of this year. Another program we have going is the Farmers of Heart's Cardiovascular Health Program. This builds on a pilot screening program, which consisted of health checks in marts and co-ops. So in other words, workplaces where farmers congregate. And the health checks were conducted by the Irish Heart Foundation. So this builds on that program, and it includes a follow-up health intervention program. So again, the starting point is a health check in a workplace setting, be it a mart or co-op, and then farmers opt into a health behavior change intervention. And these are simple interventions, including health coach, mobile health by text messaging, or a combination of the two. Or farmers can also opt out. And there's follow-up data collection at 26 weeks and 52 weeks. And the key outcome measures are looking at whether farmers follow up and use GP services. We're looking at health behavior change and whether it results in reduced cardiovascular disease risk. And in terms of baseline findings, a high proportion of farmers were found to have 4 more risk factors for cardiovascular disease, and 3/4 of those who completed the health check were advised to see their GP based on the findings of the health check. And what was also striking was farmers' lack of awareness of having clinical risk factors for cardiovascular disease. So this study and this program is ongoing. A program that's about to start, or just the earlier meetings have commenced with it, is called CORD. CORD is an Irish word for friends or friendship. So it's Construction and Industry Alliance to Reduce Suicide. We know that suicide is particularly high amongst the construction sector. So we're using the Mates in Construction program in Australia as a template to develop a similar program in Ireland. And the key approach is to look at the 3 kind of key avenues for intervention with suicide prevention. So look at using universal, selective and indicated approaches. And our focus is on trying to understand the unique context of suicide within the construction sector, to define and refine evidence-based and user-informed resources, working with the industry partners to deliver these resources, and then to evaluate their acceptability and impact. So the key kind of outcomes and outputs are mentioned there. But as most people know, it's very difficult to base effectiveness in terms of suicide prevention on changes to suicide rates because of the low incidence of suicide, thankfully. So other proxy measures like intention to seek help or to offer help, awareness of services, or reduction in stigma are some of the key measures we'll be looking at. So the last couple of slides then, this is a final program that I'll talk about. It's called Men on the Move. This has been evaluated by Dr. Paula Carl, who was the PI in this program. But I'm glad to say this is an example of a program that has now been scaled up within the health services. So prior to lockdown, about 15 local sports partnerships were funded to scale up and roll out the program. So one of the key, I suppose, successes of men's health policy has been our ability to develop evidence-based programs through good partnerships between academic, statutory, and local voluntary organizations. And then to attract funding, not just to develop the programs, but then to try and scale them up as well. So I'm conscious of the time, so I won't go any further. The final point I'd make is that we're also working with international partners. We've worked closely with WHO in terms of the development of the men's health strategy. And we're also big fans of Peter Baker and Global Action on Men's Health. So I'm sure there'll be questions later. I'll be glad to answer them then. Thank you.
Great. Thank you so much, Noel. That was an excellent presentation, and you did a great job covering a lot of ground in a short amount of time. So we really appreciate all the updates on what you're working on in Ireland. So our next speaker is my friend Anna Fadich Tomsitch. Anna is the Vice President of Men's Health Network, where she oversees fundraising activities, the execution of programs and services related to outreach and health promotion, as well as the organization's various web platforms. She also supervises MHN's international activities and relationships. As a certified health education specialist, Anna has developed targeted disease education materials and programs, provided health discussions for participants at community health events, free screenings with national and professional sports teams, and conducted men's health seminars and lectures across the country at faith-based institutions and through MHN's Men at Work program at corporate employer sites nationwide. Anna is a member of numerous boards and committees, including the Board of Trustees of Global Action of Men's Health, and she's previously served as the chair of the APHA Men's Health Caucus. So Anna, thank you so much for being here, and I'll turn it over to you.
Thank you, Brandon, and thanks everyone for joining. Excuse any noise you hear in the background. I've got a screaming toddler and some work being done at the house today that was unexpected. So we just got out of Men's Health Week, and it was a very productive and successful week from what we can see. So I'm going to talk a little bit about the history of Men's Health Week here in the States and how we've worked with our international friends to create the International Men's Health Week. Next slide, please. A little bit about us, for those of you who aren't too familiar with Men's Health Network. We are a national nonprofit organization based in Washington, D.C., but we have our fingers in a lot of different activities across the globe. Our main mission is to reduce premature mortality of men and boys, to provide education and different services for men and their families. And we reach them where they live, work, play, and pray, because we see that if you go to where the men are, they're more likely to listen, and they're more likely to pay attention to the messaging, and you can relate it back to what we like to do for Father's Day, relating family health and men's health to being a dad and being a role model, so that men can kind of take on that role. Next slide, please. Men's Health Week initially started back in 1994 with the signing into law by President Bill Clinton, and that was assisted by Congressman Bill Richardson and Bob Dole. So that was signed into law, and then we had a lot of our colleagues contacting us because, as we had mentioned, we work with, as Brandon had mentioned, we work with different corporate sites, so like UPS, John Deere, Harley Davidson, and a lot of these folks, even churches, weren't able to do something the week of Men's Health Week, so they kept asking, can we do it certain times during the month? So we expanded Men's Health Month, which we provide educational materials, we provide programs, we have a kind of program in a box, our Health Zone Toolkit, which we give to people to help them plan events, since we can't. We have a small staff in the DC office, and so we can't plan everything for everyone, but if we can give you the tools on how to do an event, we're more than happy to assist and provide whatever materials we can. So that's where we have the Men's Health Week and Men's Health Month. And I believe it was back in the early 2000s, we had gone to an international meeting with our partners and realized that, you know, if we did this as a joint effort and made it International Men's Health Week, then we have a much larger impact. So some of the things that we do during this month and this week is we partner with our international partners to do publications and Twitter chats, different webinars that anyone can participate in. So to make sure that we're addressing the issues on an international level. Next slide, please. So some of the things, we just finished Men's Health Week, like I said. We had a Wear Blue Day that was on Friday, June 18th. So I hope everyone had participated in that. What we do for Wear Blue Day is we ask people to post images of themselves or their pets or their loved ones, or even things that are blue around them. So wearing blue, and then putting out a message as to why you wear blue. So we've had people who are putting out messages as, I wear blue for my dad, I wear blue for my husband, I wear blue for my son. You know, there's some folks that say, I do it for my coworkers who aren't as in tune with their health as some of us women are. So you can wear blue for anyone, and in memory of people who are special to you. During the month, we use the hashtags Men's Health Month, Men's Health Week, Show Us Your Blue, and Wear Blue. And it's not too late. We still promote our Show Us Your Blue and Wear Blue outside of the Friday. We ask people to do it throughout the month of June, whenever they remember to wear blue. And so we have a couple of things coming up. We've had 2 Twitter chats already online, and we have 2 more. We have a Twitter chat on June 24th, if anyone is interested. It's on mental health. But I believe that one is with the Office of Minority Health here in the States, with partnerships with the Nursing Association, and the Men's Health Caucus here is supporting it as well as the Global Men's Health Group. Also that day on June 24th, we have a congressional briefing. So MHN puts on these briefings a few times a year, but with COVID, we're not able to do it in person. So we're going to do this one online, and everyone is invited to join. For any of these, if you would like to send an email, the email will be at the end of my slides, but also you can send a note to me on here to let me know you want to be receive an invite. So send me your email. And so that one is also going to be on COVID and men's health. And that's going to be overseen or sponsored by Congressman Payne Jr. of New Jersey. And we're going to have some really top-notch speakers that are going to be discussing men's health, COVID, and what's going on during this time. So again, both of those, the Twitter chat and the congressional briefing, are on June 24th. And let's see, next slide, please. These are some examples of what we've asked people to do, and this is them just wearing blue in doctor's offices. If you're at regular office, we have here the office of the health secretary down on the bottom left. This is from a few years ago, but our theme this year was wear blue and a mask too, just because we wanted to make people aware that, you know, being safe, especially during this time of COVID, is very important. We still, although the US has opened up, and I know here in California, there's a lot of people not wearing masks anymore, and it's on your judgment whether you are vaccinated or not to make that announcement. But you know, it is still concerned. There is still COVID possibilities, and so we wanted to make sure this was, you know, top of mind, that, you know, we're wearing blue to support men's health, but also to recognize that it is important for men who are less likely to go to the doctor to be aware of their health so that they don't get sick and have problems later on. Next slide. Here in the States, we also do recognition of Men's Health Week. So the White House, the president issues a proclamation announcing the week recognizes Men's Health Week. We have proclamations from different governors, mayors across the country and in the US territories who proclaim the week or the month as Men's Health Month. And then what we do is we contact our congressional members in Congress to say, your mayor or your governor has issued this proclamation. Can we do a photo op with you? Can we present you with the proclamation, just so that they can see how important it is? Because sometimes these folks that are in Congress in Washington, D.C. aren't with their constituents on a regular basis. So to show them that there are these communities that are supporting this and that it is a very important issue, because ultimately what we would like to do is see an Office of Men's Health established. We have an Office of Women's Health, and we are in no way trying to take away from women's health. We find that men's health and women's health coincide together very well. Excuse me, and it's not just on sexual reproductive health issues. So, you know, men can help women find different cancers and be supportive in their cancer journeys and their medical journeys, as well as women can do the same for men. We just have to make this, you know, a little bit more accessible. And then on the state, local, and federal levels, we have a lot of activities that are happening across the country throughout the month, constantly starting in probably the end of April. We start getting phone calls to Men's Health Network about events going on and if we can help promote and how we can help with providing the materials for it. So we try to put those up on a website. We try to promote them as well as we can, because we want to make sure that our partners have the largest reach that they can have. Next slide, please. And that would be it. So here's the information. If you would like information about the Twitter chats or the congressional briefing, if you want to follow us, we do a lot of posting. Our communication staff is really great about putting out health information for men's health. If you're doing an event and would like us to help with promoting it, we would love to do that. Or, you know, if you want to participate and co-host some events with us on Twitter or Facebook, we would love that. So please feel free to send us a message and we can discuss how we can do partnerships. Thanks.
Great. Thank you so much, Anna. Really appreciate that overview of all the awesome things that you are working on at MHN, especially related to Men's Health Month and Men's Health Week. So I really want to thank all of our presenters today. This was a ton of great information. And we do have a few minutes for questions. I saw that Dr. Sal had a question in here, particularly related to the sheds in Ireland. And Sal, I don't know if you wanted to pop on and ask your question live.
Live we are. I'm just curious to see if women's organizations or groups or anybody really has pushed back on the fact that you're creating a space for men. I don't know that it's been a problem, and I know there's a couple of sheds organized in the US, which I think is a fabulous and very important idea. But as these things get bigger and bigger, sometimes they can be misconstrued as something else, or they become politicized. And the good that you do in the men's health space seems to always have a counterpoint. So I'm just curious if there's been any pushback on that.
No, it's a good question, but not really. I mean, it's very much a grassroots development. The sheds are generally organized themselves. It's a group of men who get together in a fairly modest housing or dwelling. There's not much funding attached. And there's two other factors that are worth noting. One is we've done some interviews with shedders, significant others, and there's generally really positive reaction to the impact the sheds is having on their loved ones. A lot of the men were at transition points in their lives, maybe suffering mental health issues or, struggling with retirement, and the shed was an opportunity to kind of reclaim a sense of identity and purpose. So that's really important. And the second point is a lot of the sheds get involved in community activity, in terms of contributing to community, including some fundraising activities. So more and more sheds are being seen as a positive force within the local community and are generally really well received.
Thanks a lot. Because as these things become more and more popular, more and more visible, you sometimes fly under the radar and nobody really pays much attention. But then when you see funding or you do fundraising to grow something into a national presence, which is what we need on all of these fronts to really make a difference. Being local is good, but
I think the funding is the key thing.
What's that?
I think the funding is the key thing. If the sheds start attracting large pots of funding, then it could become more contentious.
Yeah, I'm not quite sure how to address that. It's a very contentious environment, so no good deed goes unpunished these days by unfortunately some folks. So I do wonder, and it goes along with this comment that well, it's men's fault that they're in such lousy shape. We hear that in the States too. It's not particularly constructive, but
no.
Sometimes that's been the main bulwark of problems we've faced on advancing men's health.
Yeah.
Thank you. I see that Crystal had a question as well. Crystal, would you like to ask that live?
Sure. My question is about working with primary care providers to improve men's health. I know there's a lot of emphasis on patients, but I would like to personally explore working with providers, and I would love to hear something about your experiences doing that.
Doris, would you like to take that question to begin? I think you're on mute. Well, it looks like you're still on mute. I'm sorry.
Anyone can answer the question. I just am interested in anybody's experiences.
We've had some experience with our Engage men's health training program in engaging training GPs.
But the problem in Germany is that we do not have special training for men and special programs. And what my question to Noel and to Anna is, you have very good programs for men's health, and I saw you have a lot of action, special action. And can you measure the success in declining the gap in the life expectancy between men and women? Is there any success? What I have analyzed for Germany, the premature mortality. That means the mortality before the age of 70 years. And I see that we cannot decrease the gap between men and women. The healthcare system is not so bad in Germany, but we do not have special methods for men's health. But you have in Ireland, in United States. Can you measure the success of your activities?
That's a really good question,
Do you
Doris.
publish such things?
Yeah, it's a very difficult thing to demonstrate cause and effect, I gather. I'm a qualitative researcher, so I'm probably the last person in the world to ask this question. I mean, we've reported on, I mean, life expectancy for men in Ireland has increased over the lifetime of the policy, much more so than women's. So we've reported that, but we haven't demonstrated, we can't demonstrate what elements of the policy implementation cause that. Sorry.
But we have a difference in Germany of 4.8 years between men and women. And that is over the last 10, 15 years constant. We cannot decrease this gap. What is the success in Ireland?
In the last 10 or 12 years, the gap is reduced by about 1.5 years.
But the women increase the life expectancy in the same time.
Yes, but men increased more.
Yeah.
But I'm not suggesting that's because we have a national men's health policy. I don't think you can demonstrate that cause and effect. I can't anyway.
So I think for us, if Dr. Giorgianni wants to speak on it, Sal does a lot of the research work for us and the writing for us. So I don't know. I think definitely from when I mean, I started MHN 11 years ago. Definitely from then to today, there's definitely been a change in the awareness in men and in their acceptance of going to the doctor and doing things for their own health. I don't think that the actual life expectancy has changed. I think it's still 5 years difference. But in terms of Crystal, your question, we have worked with physicians in the past, and we're part of different organizations like the Urology Association and the Public Health Association, the Clinical Oncology ASCO. So for us, educating the doctors in that way and reaching physicians in that way, we also have done mailings to physicians' offices around the different programs that we have, really trying to get them to understand the importance of it. And I believe there's a good number of physicians that contact us every year, in some hospital systems as well, around Men's Health Month, around Prostate Cancer Awareness Month in September, trying to get information to give to their patients as they're coming in, because they realize the importance of it. So we do have, we actually have a medical advisory board of over 800 health professionals. So that's therapists and medical doctors, DOs, across the whole gamut. So when we need something, we reach out to them and they can reach back out to us whenever they need anything. So there's not been a study that has been done. We've been trying to work with the medical schools, particularly the osteopathic schools, because I think it's a little bit easier to get in with them. We have someone on our board from one of the osteopathic medical schools that thinks that, if we were to create a men's health curriculum and implement it in the schools, then that could potentially help train these new doctors, to focus a lot more on men's health and not just that little bit on the sexual reproductive side of things. So we're trying. It's very difficult, especially to change medical school curriculum. But in working with doctors on a one-on-one basis in the hospital systems themselves, we have done some kind of work in that. Definitely not as much as we would like to do, and there's always more that could be done, but we're working on it at MHN.
Yeah, I
Thank
can
you.
weigh in there for a second. Excuse me. Some of the inside baseball, the behind the scenes discussions when Men's Health Network approached the American Osteopathic Medical Association to develop a track in men's health. We had several advocates for that within the higher rankings of the AOA. And I know this because I was a member and secretary of the AOA Foundation. So I was privy to a lot of the internal discussions there behind the scenes. And what happened there was the women objected. The women physicians objected and said, why are we putting an emphasis on men's health? And people tried to make the argument that, well, there's OBGYN and they do primary care. And they said, well, that's great. Let's have the urology section do primary care. And there was this back and forth, but it was very unhealthy when the specter of quid pro quos or why are we setting guys up something special. So it unfortunately died on the vine early enough. About 4 or 5 years ago, I co-published a paper with some colleagues on developing the discipline of men's health as an emphasis or a push to get people to start thinking about how to do that, because clearly turfing this over to urologists alone doesn't really solve the problem of getting men healthy early on before they think of urologists as where they should be going. That got a little bit of traction, but a very valuable insight that we got about this whole issue, because I constantly talk about there is no men's health specialist, and that's a detriment. And that was one of the reasons that women's health became a really important focus of medical education. And one of the insights we got on a series of papers that I was a co-author on issues of men's health and mental health and COVID and men's health, was that from one of our deans, one of the medical school deans, who was very supportive of what we do. And he said, look, until the licensing and licensing board, the training boards, the residency boards, all put requirements for men's health as part of their examination, part of their certification of training, we're not going to put it into our curriculum. So you're not going to see men's health discipline evolving until it's really that these boards, these specialty boards, or the overarching license board, agree that that's important. So I think that's another avenue to pursue, but it's been an uphill struggle. So as Anna eloquently said, all of us who do this kind of work here, we constantly approach primary care physicians in many, many different routes, many, many different ways, but it's an uphill struggle. And I don't think it's made a dent in life expectancies. Excuse me.
Thank you, Sal.
It's still where it was.
Thank you, Sal.
Thank
So
you.
we had, I want to try to recognize 3 people who posted a question or had their hand up. So first I want to go to Patricia.
Yes, thank you for inviting me. I am the chair of health equity for the American Public Health Association. So the issue of equity in men and women certainly is at the core of our discussion. And I have a lot of experience in terms of working with men's health, in terms of changing the paradigm. In reality, the paradigm of maternal and child care health has been domineering all the thinking for many decades in reality. To move away from that type of thinking and start to focus in men as a very unique entity of discussion, in which we focus in their identity development, in their developmental issues, as well as their how to develop a profile within the current society, has been very important. Unfortunately, that doesn't happen. I think that the whole issue of blue might be very nice, but it's very superficial. There are many other key elements that should be integrated. one of our best efforts in the city of Chicago has been to work with Mexican men who come with the patterns of violence in their homes as a problem-solving instrument, and start to change in how that element constitutes part of the identity and needs to be moved away from that and replaced by other elements that allow us to negotiate and to be part of the core society in a more positive way, and develop those smooth changes. I think that from a programmatic point of view, looking into outcomes, when you look into these small programs, it's easier to conceptualize change and the need of change rather than to look into the larger statistical information, in which certainly the mortality rates, to change those, it takes an immense effort and a very united and concerted effort. But looking into these, the small definitions and details of masculinities is so important in order to start to create that paradigm and this shift of frame of work, understanding that men have their own qualities and their own development, and the services need to be developed around those topics rather than around the policy or the numbers topics at this point.
Thank you, Patricia. I think those are all excellent points. And I don't want to cut the discussion short, but I know we're coming against the hour here. I know Phoebe had her hand up, and I just wanted to see if you had a comment, Phoebe.
Okay, yes. Are you able to hear me?
Yes.
Okay, awesome. So I wanted to share for the researcher from Germany that African American men in the United States actually have a much wider gap than 5 years with regard to premature on things like income. So we would expect that someone has health insurance and they have, as a room that they would live beyond age 70 or 80. And those men in that, even with higher income, still have a shorter, much shorter life expectancy than women and then other racial groups. And so one thing that we've done is work with community-based groups such as barbershops and fraternities and other organizations within the African American and Black communities to try to help those populations. And there was one other thing that I wanted to say with regards to what the last speaker was saying with regards to masculinity. That is definitely a huge issue. Oh, I know what it was. Here it is. Okay, so you all were talking about the physicians. I'm a health educator, so obviously I focus on health behaviors and try to get people to physicians. But unfortunately, COVID really highlighted the problematic things that sometimes happen when people of color visit with physicians, and sometimes it even happens before they get to the physician. And so one thing I would ask the national people to look at is maybe training for the staff that do the intake of the patients, the patient registration, that do the blood work. I know a lot of times people say they were forced to have a doctor's appointment. They get to the doctor's appointment, they've taken off from work. The doctors say they can't see them because they didn't get the blood work that was required in order for them to address their issues for, say, for example, with diabetes or high cholesterol. And so the issues in the medical community are not only with regards to the physicians, because the male patients interact with several people before they ever get to the physician that could possibly influence in a negative direction the experience that the male has and his decision to continue with care. Does that make sense? Okay,
Absolutely.
thank you.
Thank you, Phoebe. Those are all really important points. I
And I
appreciate you
think
bringing
that, excuse me, Brandon, I think that she highlighted also the issue of programs. And I think that the barbershop model in the African-American community, I am Hispanic, so has been really an institution of masculinities development in a very positive way for African-Americans. And those are the measures that we need to start to play with before we go into the larger scope of representation.
So I know we're just about out of time, but Peter had an excellent question in the chat. And Peter, I don't know if you wanted to put that out to the audience as well.
Yes, thank you very much, Brandon. And first of all, congratulations on this meeting. It's been really interesting. So thank you for organizing it. There's so many issues have come up. So much I'd like to mention, but I know you're pressed for time. So I just wanted to really ask a question about COVID and the response to COVID. Clearly, that's highlighted so many issues in men's health, with men much more likely to get seriously ill and much more likely to die. Obviously, huge issues for women as well, but in terms of mortality and serious disease, it's mainly been men, or primarily men, or men who have been disproportionately affected. And what concerns me, looking around the world, is that there seems to have been very little policy or practice response which has taken account of that, which has taken account of gender in any meaningful way. And I'm based in the United Kingdom, and we've recently had data published which shows that men of working age are 20 to 30% less likely to take up the offer of vaccination. And I think there's a similar picture in the States, if I'm right, from what I've read. And over here, there's been no effort to try and change that. There's been no communication strategy targeted at men. Nothing's been done to actually try and understand what the barriers are for men. And it's not just about vaccination.